Yep. Hi, so today we have Anna Kaluzny. She has over 15 years of experience in the pharmaceutical industry and is an accredited consultant pharmacist specializing in medication reviews. She has experience in new claims, secondary claims, and long-term claims, and has had many years of experience in the medical legal space, providing unbiased medication and pharmaceutical reviews to assist with liability decisions and claims management. So over to you, Anna.
Thank you so much, Sophia. Hi, everyone. Thanks for joining today. That's right. I have had extensive years experience working in the pharmacy industry. I've done further training to become accredited to perform medication reviews, and I have done a lot of work since then in general practice, aged care, and in the medico-legal space as well. I get quite a few referrals coming in requesting medication reviews for secondary injury claims and long tail claims. So I thought I would talk about these areas today within the medico-legal space. As far as I'm aware, there aren't too many people with a pharmacology specialty that work in this medico-legal space. So thank you for the opportunity and having me on to discuss the work that I do. And hopefully you will find it beneficial in helping to understand a little bit more about what I do and how it may be useful in practice and in claims management. Oh, all right. Yeah, there we go. Okay, that's just a little bit about me. So in this presentation, I'll give you an idea about how medication reviews can be beneficial in liability claims, what it is that I can offer in my reports, and finally how to action the medication review within the context of a claim, as well as determining liability when it comes to medications. And I'll talk specifically about secondary injury claims and long tail claims. In a medication review, a pharmacist can comment on a wide range of things, including the recommended duration of use of a medication, expected outcomes of therapy with a certain drug, identify where a medication may not be providing benefit or maybe causing more harm than benefit in some circumstances, and when it may be appropriate to taper and cease the medication safely, particularly where withdrawal symptoms are common, such as with opioids. Medication reviews can be performed face-to-face. Most of the interviews I do are via Zoom or similar online platforms. The benefits of face-to-face interviews are that I can ask the person questions directly, often with specific questioning, developing rapport, and I can get quite a thorough medication and symptom history. In many instances, however, I receive referrals requesting a file review, which involves a review of documentation. So medical and specialist reports, dispensing histories, health summaries, clinical notes, all of those types of documents. File reviews are often requested where the client is not available for an in-person interview. And file reviews can be of benefit where the client doesn't make themselves available for an interview, where there is time constraints and information or a review of medications is needed quickly. So there can be quite a quick turnaround. Advantages of a file review are that I can refer to other reports, and if there is any information missing that might hinder the ability for me to form an opinion, then you'd be advised of that. And sometimes a supplementary report may be necessary if relevant information is not available. However, this doesn't happen very often. So regardless of whether it's a face-to-face interview or a file review, I will take a detailed medication history. So the medication history both before and after the date of the compensable injury. And this includes not only prescribed medicines, but over-the-counter medicines, supplements, as well as illicit substances where they're disclosed. The medication timeline includes when each medication was started and when it was stopped. If it was stopped, were there any gaps in treatment? If so, did the person stop taking the medication at any point in time and for how long? Is the person seeing more than one doctor? Are they having medication dispensed at more than one pharmacy? On occasion, people will have only certain medications prescribed by one doctor and others from another doctor without necessarily disclosing this information to the prescribers or within their claim. And certainly I see people visiting and having their medications dispensed at multiple pharmacies. So obtaining a thorough history, reviewing documentation provided with the referral can shed a bit of light, as well as highlight gaps in the information provided, which I believe is useful too. Sometimes people will omit or overlook medications when interviewing them, and having documentation available can be helpful to review before an interview to then be able to prompt the individual. So once a full medication history is obtained, I will identify the medications the individual is taking which are related to the compensable injury and identify medications taken for reasons not related to the injury. I will discuss medication interactions, medication side effects, and comment on the appropriateness of the medications within the scope of my own expertise, of course. So from a pharmacological perspective and my specialty in pharmacotherapy and medications. Quite often people will be prescribed medications for pre-existing conditions and issues unrelated to the compensable injury and be required to take these medications alongside other medications that have been prescribed as a result of the injury. It is important to then to obtain a thorough history of pre-existing conditions and medications and how they might influence symptom presentation and inform decision-making when determining liability due to medication-related secondary injuries. I'll go into this in more detail soon. I have certainly seen many examples of people claiming for secondary injuries or symptoms that in fact have been established well before the compensable injury occurred and are related to non-compensable medications. So this highlights the importance of understanding when a medication or substance was started relative to when the individual's symptoms first occurred, and establishing a symptom timeline to understand how the symptoms have progressed or how severe they are. And this helps to more accurately establish or determine causality. So to summarize this section, I put all of this information together to form a timeline and then discuss and form an opinion about the reasonable justification for whether a medication is likely or unlikely to have been a causative or contributing factor for the claimed injuries. And this, of course, is of great benefit in secondary injury claims. It's a great benefit really to identify where a medication review may be appropriate or beneficial, and certainly an independent medication review would be beneficial soon after the injury occurs, soon after medications for the compensable injury have been started, before symptoms have developed, to offer medication management strategies, medication counselling and education, as well as lifestyle and self-care strategies around medications to reduce the risk of symptom development in the first place, and reduce risk of adverse effects of medications. Okay, so let's move on to secondary injuries and how medication reviews can assist with claims decisions. So there appears to be a growth in medication-related secondary injury claims in the work cover space. Under the workers' compensation system, it is not just the primary injury that is covered. An individual may be entitled to claim for a secondary injury. The secondary injuries are defined as injuries caused by the primary injury. Secondary injuries occur after the initial or primary compensable injury. Secondary injuries can occur gradually, often weeks or months after that initial injury. The secondary injury needs to be a discrete injury, meaning it is clearly distinct from the original injury. So I want to give you some examples of secondary injuries. So, for example, a person suffers an injury to their back during the course of their employment. As a consequence of altered gait, that person then develops hip problems for which they require ongoing treatment. The hip problems would be a secondary injury. Another example may be a person suffers injury to their left shoulder to the extent that they are no longer able to use the shoulder for anything more than lifting light objects. As a consequence of having to rely on their right shoulder more to overcompensate for that primary injury in the left shoulder, the right shoulder develops a tear. this right shoulder injury is now a secondary injury. And very commonly, we see medication-related secondary injury claims, and I'm certainly seeing this more and more. For example, this might look like a person suffers an injury to their back for which they require analgesic medication. As a consequence of taking the analgesic medication, the individual now claims to have adverse effects from the medication, claiming these adverse effects as secondary injuries. Examples of secondary injury claims attributed to medications that I commonly see are bruxism, dry mouth, reflux, constipation, sexual dysfunction, and dental injuries. Unlike some secondary injuries that may appear to be more obvious, medication-related secondary injury claims aren't always that clear-cut, as there are a lot of other variable or influencing factors that may be causing or contributing to the claimed injuries. Further information about the secondary injury and medications is essential. That might include medical evidence for the treatment of that injury, as well as a description of when and how the secondary injury started. For medication-related secondary injury claims, I will gather this information in either the interview or file review. And as part of the work that I do in this medico-legal space, as I mentioned, I will take a detailed history, including a timeline for the secondary injury and any treatment being received to manage or treat that injury. This information all forms part of the evidence used to build a connection, if there is one, between the original work-related injury and the secondary injury. So in a nutshell, for a secondary claim to be successful, the individual or those acting on the claimant's behalf need to prove that the secondary injury is a direct result of the initial worker's, the compensable injury. And that's what the medication review is really all about when it comes to medication-related secondary injury claims. There needs to be medical evidence, which might include a pharmacological or medication review, such as the one I can provide, that the secondary injury resulted from the initial worker's compensable injury. Okay, so I'd like to give some more examples. I had someone I performed a face-to-face interview with. The person had claimed secondary injuries, which were significant tooth decay, claiming this was attributed to analgesic medication prescribed as a result of the compensable injury, which required pain management. His tooth decay was quite significant and severe, which made me query whether it was the compensable medications that had caused this, given the relatively low doses and short duration of use. This would have been highly unusual. During the interview process, the person actually disclosed that they in fact had a long history of methamphetamine use. For the tooth decay to be as severe as it was at that point in time versus the amount and duration of analgesic medication used, we could be quite confident that the decay was in fact attributed to the history of illicit substance use, the methamphetamine, and not the medication prescribed for the compensable injury. Another example I can use is someone claiming for secondary injuries, which were gastrointestinal symptoms, including reflux. And again, these secondary injuries were claimed to be caused by medications prescribed to manage the initial injury or primary injury. Review of the documentation as part of a file review in this case revealed that the symptoms were in fact related to functional causes unrelated to the compensable injury, which were established years prior to that injury. To summarise this section, it is possible for a person to be compensated under work cover for secondary injuries. What constitutes a compensable secondary injury under work cover can be complex, however, particularly where medications are involved. Medication reviews can help determine causation and again assist with liability decisions. There needs to be proof that the initial injury contributed to or caused the development of the secondary condition. Often there are influencing factors, pre-existing conditions, or non-compensable medications that must be ruled out to determine causation and accurately determine liability. Okay, so moving on to long tail claims. Long-term workers' compensation claims are defined as claims with a time loss of at least 6 months. However, certainly we see time losses of years to decades. It is interesting to note that long periods of involvement in work cover systems are associated with poorer health and quality of life outcomes. And of course, there is a financial aspect to consider as well. These long-term claims are obviously very costly, both to insurers and employers. And in Victoria, where I'm based, in Victoria alone, benefits exceed the premiums paid by businesses to fund the scheme, exceeding $1.1 billion each year. This is mostly due to the number of individuals that remain on work cover benefits for over 130 weeks. And these claims often involve funding medications for extended periods of time. Okay. With my experience with long tail claims, there are several things that I think are important to keep in mind. I think it's important to keep track and review all claims regularly, not just the current or open claims. I think it's important to have or develop a plan for each of the long tail claims, and to consider having a strategy and plan for every claim, both new or open, as well as long tail, a plan that might include closing out future medical exposure, and this includes medications where appropriate. Okay. As part of this plan or strategy, it's valuable to address unresolved medication and treatment issues, and a medication review can be of benefit here. To identify the nature and treatment regimen the person is undertaking, does the individual feel any benefit from the treatment? It's valuable to identify and address the worker's needs to maximise return to work and minimise scheme liabilities, particularly in workers who have not returned to work. Identifying any medication-related barriers to returning to work or engaging in regular work activities with a structured medication review can be of benefit. I'd like to highlight the significance of reviewing long-term claims with one example in particular. I was referred a long-tail claim when I was asked to do a medication review. This long-tail claim was over 20 years old, and medication was being funded for this whole period of time until, for whatever reason, someone queried it and requested this medication review. So in this case, there were multiple opioid medications being regularly prescribed and dispensed 20 years on at several different pharmacies. So it took some time to collate and establish a timeline given the long history, but what became evident was that high quantities of opioids, and this was multiple different opioids, were being prescribed and dispensed, and during some periods, and this is only from the information and dispensing histories provided. I'm sure it wasn't even the complete picture, but certainly gave an insight into the large quantities of opioids that were being funded. And so there were periods where as much as 60 endone or oxycodone tablets were dispensed every 5 days. So I submitted my report, and eventually this actually became an investigation into overprescribing and misuse of medication, and really, taking advantage of the funding available, which was occurring over a period of decades. And I have no doubt that initially opioid use in this case was relevant. It was necessary to manage the primary injury. But 20 years later, at such high quantities, really, I can't see much benefit being derived, and certainly leading to more harm than benefit in this case. Unfortunately, we do see cases like this, and of course, they're not all as dire as the one I just described, but it highlights the fact that it is relevant and important to review these long tail claims periodically. Okay, so with long tail claims, again, I like to establish a timeline from injury to present and track opioid and other medication regimens throughout that time. This gives me an idea of the duration of medication use, doses, and effectiveness of therapy over that time. It also allows me to see if there have been any attempts to taper and cease the medications. In determining whether a person is getting benefit from continued medication use, I would like to understand their level of functioning, whether they have been able to get back to work or not. If not, then are we really seeing an improvement in function? It's a simple question to ask, are the medications helping? When reviewing a file, I'll look at the claimant's medical history, see if there are any other medical conditions being treated, whether they're related to the claim or not, and how this may impact on pain and function. And I'll comment on other medications, any possible interactions between these medications. And I'll also comment on how the medications would be impacting, if at all, on both physical and cognitive function. This is important when determining whether a person is fit for work or fit for returning to work, for example. And there is research to show that people who use, for example, opioids long-term perform worse in measures of attention and had significantly worse pain self-efficacy beliefs than those people with chronic pain who weren't taking long-term opioids. And this can certainly, affect the ability for people to return to work. Summarize, of course, there is a place for medications. However, it is important to review the use of medications periodically. For example, a review of opioids is recommended every 3 months. I realize this may be far-fetched and it doesn't happen very frequently. But always refer back to the evidence. Request a medication review. Is the medication still appropriate? Is the dose still appropriate? Medications are not without harms. It's always important to consider adverse effects, even when the person has been using the medications for a long time. Consider non-drug strategies for chronic conditions, for example, chronic pain management. And of course, the focus really should be on function and quality of life and whether medications are helping or hindering in this area. Okay, so finally, I wanted to talk a little bit about actioning medication reviews. In my reports, I might include strategies for the claimant to improve their medication management and, of course, provide information and opinion for claims managers in making liability decisions based on the information provided within a medication review. So, for example, where we are seeing long-term opioid use without an improvement of function or without improvement in pain, or where there is evidence of aberrant behaviour or where harms might outweigh the benefit of treatment, I might make a recommendation that tapering and ceasing the opioid medication may be beneficial in this case and suggest that the claimant is referred to their prescriber to commence a weaning plan for opioids, for example. And I would provide a recommendation for a weaning plan, which may vary depending on the dose and duration of use of the medication. So again, in the example of opioids, the higher the dose and the longer the duration of opioid use, the slower the tapering process generally. So this can take maybe weeks to months to do so safely and reduce the risk of or severity of withdrawal effects from opioids. So, and it's all very individual. I would recommend pain education resources and other resources that could be utilised by the claimant, as well as other non-drug strategies where appropriate. And as I mentioned earlier, with the information in the medication review, it can help with establishing a strategy or plan in how to continue to manage the claim, particularly where you see people taking opioids or other medications for a long time, years, often decades. It would be reasonable to query, are these medications still indicated at this point? Are they still safe, appropriate, or the best option at any specific point in time? And I would offer advice too as to what to expect in terms of side effects or resolution of adverse effects if the medication dose is reduced or if the medication is ceased. How to identify whether a claimant would benefit from a medication review? Well, soon after the primary injury, having a medication review soon after the injury can help with a claim plan or strategy, identifying the potential issues and how to manage any problems, or ideally prevent any issues in the future. Long-term use of high-risk medications, you would ideally be reviewing opioid use, for example, start talking about tapering opioid doses, looking at improvement in function, looking at pain education. Often we'll see, I'll come across a lot of cases where opioid therapy is being continued after acute pain treatment with no clear indication for continued use. So tapering and stopping opioids, and other high-risk medications is important. And this highlights the need for regular assessment of the patient to determine an ongoing need for medications. And finally, where there is polydrug use, so multiple medications being used to treat an injury. And the general rule here is the more medications a person uses, the greater the risk of interactions and adverse effects. Okay, to summarize, medication reviews can be of benefit throughout different stages of a claim. They can be used as a tool to manage and reduce the risk of anticipated medication-related issues, and finally, assist in liability decision-making. All right, we come to an end. So thank you again for joining me. Any questions?
Thank you, Anna, for a very comprehensive presentation. If anyone has any questions, please unmute yourself and come forward. I don't see any.
No.
Oh, sorry.
No, I'm happy for anyone to email me as well if you have any questions that you think of later on.
Yep. I don't see any questions in the chat box as well. So yeah, if there are no questions, then we can wrap up the seminar. Oh, sorry. Someone just asked, do you deal with reviews in Sydney?
Yes, I do. I perform medication reviews nationwide. So I do a lot of work in South Australia, for example, Queensland, definitely New South Wales as well. Yeah.
Yep. Does anyone else have any questions? Oh, yep. So someone asked if you are involved in cannabis oil.
I certainly can offer opinion about cannabis oil. Again, I'm seeing more and more cases that involve cannabis oil use, and I have provided opinion about cannabis oil in the past, so I could absolutely help with that. But happy for you to get in touch and provide sort of a more specific question to see how I can help in that specific case.
Yeah, and someone says thank you. So
Pleasure.
yeah.
You
Does anyone have any other questions? If not, we will wrap up the seminar today. And thank you so much, Anna, for doing this for us. It's been a pleasure.
Thank you.
Yeah, so thank you everyone for coming, and I'll be sending through the recording and the slides as well to you this evening. Thank you.